presentation. Thank you. From our wonderful program area managers, specialists, coordinators, and center directors. We are confident that you will find the upcoming information both informative and valuable. But before we dive in, a couple quick notes. This presentation, as you heard, is being recorded and will be available on the SCF YouTube channel. If you would like to turn on your cameras and see your smiling faces, that would be great, but please keep yourself muted throughout the whole presentation, and we'll add comments and questions into the chat, and we can discuss at the end. So without further ado, allow me to introduce you to Peter, our Quality and Data Improvement Coordinator. Peter, over to you.
Hello, everyone, and welcome to the data segment for Data Jam. The start of the year has been great in rolling over data-related practices from the previous program year, all while still introducing newer and more efficient ways of presenting our data. We continue to use weekly, monthly, and quarterly methods of sharing data with each other and updating those systems to reflect the changes made to program operations this year. Changes to our team structures have also been able to occur while still maintaining data tracking efforts, and newer team members have been able to adopt data-related practices through using our established systems. As we reflect over the quarter's performance measures, it is important to recognize how much we benefit from incremental and sustainable data practices. Consistency in the tasks that we do help to identify trends in our data, and they indicate the smaller variables and habits that we can change to move closer toward our program goals and metrics. Each of our service areas today will be providing more in-depth detail of the organization's performance over quarter one, but we'll discuss some of the more notable shifts in the data, as well as making some year-over-year comparisons with our performance from the previous year's quarter one numbers. EHS enrollment increased steadily over the quarter with a year-over-year increase in average enrollment, which was effective in fulfilling the goals of our full enrollment initiative, of which we are still seeing the benefits of in quarter two. Changes to our policies and procedures also displayed a notable year-over-year increase to the eligibility categories of public assistance, foster care, and homelessness, and the new distribution of participant categorizations show that we are meeting our goals of better servicing families with higher need in the Southern Nevada community. The data showed year-over-year average increases in Q1 numbers with up-to-date well baby checks, goal setting, and attendance, while areas of opportunity for procedural improvements were seen among the needs identified, immunization, and screening measures. EBHV displayed similar changes to eligibility metrics where public assistance, foster care, and homelessness categories were a higher representation of the enrollments. Higher year-over-year reported measures on average for EBHV included needs identified closed and immunizations, while areas of opportunity consisted of needs identified, screenings, and goal setting. The data on the slide is an example of why we should apply context to our numbers and appropriately explain or frame data to our team members and relevant parties. Although we may be receiving lower reported average percentages for certain performance measures, our increased participant count may indicate that absolute numbers compared to last year are similar and that our operational capacities are slowly catching up to having more families enrolled. This is especially relevant when you consider the growing team that we have and how we are all still adjusting to new workplace dynamics and roles. This program year, we will explore the different ways that we can present data to audiences like parents of the program and potential partners within the community. Accessibility to data needs to remain a high priority, especially in this current age where it can be perceived as overwhelming, especially if the data is not properly contextualized for a given audience. The revisiting of long-standing data-related systems and deliverables will be reviewed for their ability to be shared with others and whether they can present program performance measures in an engaging manner. We will also look at the different ways we can refine the data process from beginning to end. From tracking, sorting, and storing data, our teams need to feel comfortable with each phase involved. As we continue to improve operational efficiency through our new team members and organization structure, we should expect to see improvements in performance outcomes in the next quarter. Sunrise has a unique challenge of scaling different types of operations alongside our increasing enrollment count due to the full enrollment initiative. Our teams will maximize on professional development opportunities to improve internal capabilities when it comes to understanding and utilizing data, especially among those of us who are newer to their position and still navigating the systems used to track performance measures within Sunrise. Thank you to everyone for taking time to listen to this data segment. And now, Jessica, could you let us know what's going on with ERSI?
Thank you, Peter. Hello, everybody. My name is Jessica. I am an RC coordinator. I don't know if I turn my camera off. Let me turn my camera on for you guys. Perfect. Thank you. Thank you, Peter. Hello, everybody. My name is Jessica Torres. I am an RC coordinator. RC stands for eligibility, recruitment, selection, enrollment, and attendance. So we will be reviewing some of Q1 data for program year 2023-2024 Q1. So Q1 is going to be the period from August to November 2024. The first line graph that you will see is our early Head Start enrollment. We are funded for 442 slots in Q1, and throughout the start of the program year, the line did trend upwards. In August, we had 144 children enrolled in early Head Start, and we finished Q1 with 254. This was an increase of 110 enrolled applicants. This was an increase of 57% enrollment. We made efforts to increase and meet full enrollment, but we were not able to meet it due to staffing challenges and transitions in and out of our organization in our different departments. During this, we took the time to continue and review policies and procedures to ensure that new staff were properly trained. We also took the time to review our policies and procedures to review and ensure that the policies were aligned with our full enrollment initiative that we had, and we were working towards to meet our goal for the month of February. In the bottom left-hand corner, you will see Q1 enrollment. You will see for early Head Start center base, which we are funded for 328, early Head Start home base, which we are funded for 114, evidence-based home visiting early Head Start, which we are funded for 25 spots. SCF Pre-K, we are funded for 10 spots. Oh, sorry, my connection on. This is a private program offered at West Campus. And you will also see the Nevada Ready enrollment, which we are funded for 15 spots in our Q1 period. You will see throughout the quarter, we did not meet our full enrollment for the reasons I mentioned earlier, but enrollment did gradually increase monthly for EHS. Our goal in Q1 was to increase our funded enrollment to meet our goal by February 2024 and be fully enrolled by the end of the full enrollment initiative plan. We worked on meeting our full enrollment by being more intentional on recruiting and initiating services provided to families during enrollment. We have been making efforts in recruiting to reach full enrollment and build our priority list. You will see for Q1 on the right side of the enrollment bar, you will see the donut chart for Q1 recruitment efforts. You can see that our most effective method of recruitment for Q1 was word of mouth. So word of mouth would be a friend told another friend, or a previous employer shared the information to a friend, a relative, or somebody that reached out to us to enroll in our program. For Q1, we had 32.2% of our recruitment was from word of mouth. The second most effective recruitment was referred by agency, which was 22.5%, and this is our community partner referrals. Third most effective recruitment is the search, Google, Yahoo, etc., which is 17.6%. Then we have recruitment events. In the Q1 period, we participated in 14 recruitment events. This provided us with 11.8% of the enrollment that we obtained for Q1 was from our recruitment. And then we have recruitment from siblings. Children currently enrolled or previously enrolled was 8.6. Current previous SCF team members, 4.1. This is team members that return and enroll in our program. And families that drove or walked by the office or the center, this is 2.3. And lastly, we have social media with 1%. On the right-hand side, we can see Q1 center-based average daily attendance. The lines for EHS center-based and for Nevada trend downward from the start of quarter to end. For SCF pre-K, the line trends upward. Below that, the line graph, we have the Q1 completed home visits for Early Head Start and EVHB. You will see closer towards fall and holidays, the home visits decrease. This is due mostly for families going out of town during the holidays and also families that are sick, children that are sick, and they were not able to complete or the home visit and receive the parent educator at their home to complete the home visit. And that's my section for the data for enrollment. And now I will pass it on to Gwen, who will review the ERC continuous quality improvement. Thank you.
Good morning, everyone. My name is Quinn, and I'm the other ERC coordinator. Our first focus was to increase the promotion of mental health and disability services provided by SCF. To achieve this, we plan to include mental health and disabilities resources into recruitment events so that 100% of families are informed about these services upon enrolling in the EHS program. In Q1, mental health flyers in both Spanish and English were incorporated into recruitment materials and distributed to families during events. The second key area of opportunity involved enhancing the transition process from EHS to Head Start Acelero. Our objective was to facilitate intentional data sharing with Acelero each quarter, revise the MOU with Acelero program directors to prioritize SCF EHS children and assist family services staff in submitting necessary documentation to Acelero. We aim for a 25% enrollment rate into Head Start Acelero. In Q1, family services staff submitted Acelero interest forms and assisted parents in either uploading documents after OFA completion or submitting them to ERC. We continue to meet with Acelero monthly to share data and address any questions or concerns. The third area centered on maintaining funded enrollment and minimizing vacancies. Our strategy involved implementing an ongoing intentional recruitment plan, increasing the number of pre-screening team members, and enhancing eligibility training materials. Our goal was to achieve 100% funded enrollment by February. In Q1, we successfully increased enrollment from 133 in August to 246 in November. At the end of Q1, we enrolled 56% of our funded enrollment. That wraps up the data and CQI for ERC. Now let's hear from Dency about what's going on in education.
Hello, everyone. Good morning. Thank you for tuning into the Education Channel. My name is Dency Eusebio, and I'm one of the education managers here to report out on all the wonderful things that has happened at our child development centers. In education, our program goal is to increase the number of early childhood educators and family service professionals. In efforts to work towards our program goal, our objectives are to strengthen the pathway systems, offer more one-on-one and group opportunities for CDA candidates, embedding CDA training track for all new hires, and to create a Train the Trainer series for the team. During Q1, we had 11 new hires start with us. We started with 10 team members who started the CDA process. In October 2023, we had one new hire that was familiar with the CDA and started with us in the last stages of obtaining her CDA, the portfolio stage. All new hires have started with us during this quarter started the CDA process within 45 days of their start date. There were also some team members that started with us during this quarter and are no longer employed with SCF. However, our data stayed the same and stayed consistent during this quarter in regards to team members in the CDA process due to the fact that the trainees that separated from employment, education managers hired more trainees that replaced the ones that were initially calculated. All of our center-based team members have been working consistently towards a child development credential with ongoing support from the center directors and education managers. The third graph on the slide shows the number of our team members who are inter-rater reliable and the progress of each month. Inter-rater reliability is an online certification process through the Teaching Strategies Gold. This process helps teachers know that they are interpreting evidence of children's development and learning in ways that enable them to plan and respond appropriately to all the children in the classroom. The first bar graph per each month indicates the number of our teachers who are inter-rater reliable. For the month of August, there were 31 team members that were inter-rater reliable. By November 2023, we had a total of 32 teachers. The second bar in the lighter shade indicates those who are in progress. The last bar, the team members who have not started the process yet. By the end of quarter one, we had a total of 70% of our teachers who are inter-rater reliable. There are 9% who are in progress and 22% who have not yet started. These percentages give us a snapshot of our teaching staff that shows us who is currently inter-rater reliable and who has not yet started. The 20% that indicates they have not started can be for several reasons. One main reason is due to the fact that a new team member has not started their CDA, in which they are required to start and complete within 30 days of the start date. Once a trainee starts the CDA and is able to complete both trainings, the trainee's name will be added and will be expected to complete the TSG inter-rater reliability trainings. Tadpoles is also one of our newest programs that we have adopted. Tadpoles is a child care center management solution that provides everything in early child care providers that we need to build a strong family relationships, simplify teachers' daily tasks, and also streamlines child care center operations. Tadpoles enables our center-based team members, which includes teachers, assistant center directors, and center directors, to easily view attendance ratio, communicate with families throughout the day. Tadpoles has also give us our daily activity reports and can get sent out to families at the end of each school day. Parents shared that they enjoy the usage of Tadpoles and they're able to view pictures of their child while they're at work, and some have also utilized the option of sending a note to the teachers. During the start of quarter one, the education team members started using Tadpoles but found some gaps in utilizing the software. Education managers provided consistent support in gaining more knowledge of the usage of Tadpoles. However, as the quarter progressed, and as more questions arise, the education managers were very intentional about scheduling initial and reoccurring meetings with Tadpoles to better understand each perk that Tadpoles has to offer. Presently, our center-based staff is still utilizing the forms and documents such as attendance and transitions to ensure that all tasks and support for all children is carefully monitored until we're able to fully transition to use Tadpoles with fidelity. Until next quarter, we're excited to share more updates with you in quarter two. Thank you for tuning in to the Education Channel.
Good morning, everyone. My name is Nicole Pobletti, and I am the Manager of Education Services for Centerbase. And I'm going to be reporting out on our continuous quality improvement. As you can see, our area of opportunity number one is to increase the number of early childhood educators and family service professionals. The objectives and action plan are to strengthen the pathway system, offer more one-on-one and group opportunities for CDA candidates, include substitutes and families in pathways programs, embedding CDA training track for all new hires, implement family child development credential course for family service team members. SCF will provide families with easily accessible resources and compatible programs that best fits the family schedules and needs. The expected outcomes in the next 5 years is to increase the number of quality team members by 100%. Our quarter one updates show that education managers started to implement new tracking systems to support the education team. Management also started to implement a new process where documents were reviewed and signed to reflect each progress step. And this new tracking system ensured that managers were up to date with each trainee supporting the team more with the Pathways program. Our area of opportunity number two, beginning the installation stage of our implementation plan for nurturing and responsive caregiving. As you can see right now, the objectives and action plan are still pending. While our expected outcomes is to strengthen the teaching practices and responsiveness of individual teachers, the tool will also help monitor the success of quality improvement and relationship building. And teachers will implement the strategies of the pyramid model and understand the importance of social emotional competence and how it is critical in the first 5 years of a child's life. And again, the Q1 updates are pending that implementation stage. Our area of opportunity number 3 is building the capacity of the leadership team. Our objectives and action plan is to create a train the trainer series for active supervision, TSG, which is Teaching Strategies Gold Assessment Tool, observations and assessments, tadpoles, which is for our SCF center-based families or centers, quality environments, and individual professional development plans. The goal is to train, observe, feedback, support, planning, and monitoring. The expected outcomes is that leadership will be more knowledgeable and confident in conducting trainings to team members. 100% of team members will have a clear understanding of policies and procedures around active supervision. And 75% of team members will be more knowledgeable in understanding how Teaching Strategies Gold Assessment is important for assessing children's development and how they will use the information to plan instruction with more intention. For Q1 updates in January, education managers have been intentionally scheduling meetings with success partners from the software programs such as tadpoles in efforts to better understand systems in place, tools that can be utilized by teachers and administrators, and how to better utilize each option to its maximum potential. Education managers are still scheduling recurring meetings to gain more knowledge in each area in order to support team members in understanding each process and how to access and utilize each program with fidelity. Now on to child data outcomes. As in previous years, our objective for child data outcomes says that 85% of all children are to meet or exceed the widely held expectations in the 4 developmental domains: social, emotional, physical, language, and cognitive. Each school year, our teachers begin the first 30 days of building relationships with the children and observing milestones and tracking development. Our first checkpoint, which is a baseline checkpoint, is finalized after the first 30 days of when the children are present in the center. From there, we have 3 other checkpoint periods where teachers continue to gather data by observing the children in their care and entering into the online system Teaching Strategies Gold. At the beginning of our school year and within the first month of the quarter, we had a total of 113 center-based children who were enrolled and entered in TSG. Like previous school years, our highest number of enrolled children are our 2 to 3-year-olds with a total of 62. Our 1 to 2-year-olds had the second highest enrollment total of 42. And our youngest age group, birth to age 1, had a total of 8 children enrolled. And for our preschool age children, we had 1 lucky child. As we moved into our winter checkpoint towards the end of our first quarter, we saw there was an increase in the number of children enrolled and entered in TSG with a total of 139 center-based children. Again, the highest number of children in the age groups were our 2 to 3-year-olds. There was a slight decrease in the total number of children birth to 1, but this is more likely due to children turning of age within the checkpoint. The image with the little baby shown shows the total number of children enrolled for each period, as well as showing the total number of primary home languages the children speak or are spoken to in the home. As we look to the 2 graphs, top graphs, and compare one checkpoint to the other, we will be looking at the developmental areas and how they compare from children falling below, meeting, or exceeding in the developmental areas. The 2 snapshot reports show data for all of our center-based children combined. During baseline, we saw that there were more children meeting than falling below in all areas, with a few children exceeding in the areas of physical, language, and cognitive. During winter checkpoint, with newly enrolled children, numbers increased, children moving into new age groups, we can see that in social emotional, the number of children not meeting this area increased. A few factors play a role in that. One being that the teachers have a clear understanding of where the child is developmentally, such as observing them more than a few times to see that they can perform the skill. Another factor is some children may have had a new teacher or a few new teachers. And we know that some children turn of age during the second checkpoint before they may have moved into a new classroom with a new caregiver or had a new teacher start in their current classroom. Based on both graphs, we do see higher numbers shown for the children who are meeting each area. The additional graphs show data for our children who fall into subcategories such as dual language learners, children with IFSPs, foster children, and children who are experiencing homelessness. At the beginning, there was a total of 19 dual language learners, and of that number, 13 were assessed in their home language, or they had enough data collected to assess their development. We had 8 children in total with IFSPs who were assessed for both checkpoint periods. For our foster children, there was a total of 7 during baseline and 12 during winter who were assessed. And our children experiencing homelessness, we had a total number of 2 during baseline and 3 in the winter. Typically, if a child has consecutive attendance issues or is newly enrolled in the middle of a checkpoint, we are unable to gather enough data to pull for those children. Therefore, we archive them until they have more consistent attendance or have been there more frequently during the checkpoint period. Thank you for hearing about our children's progress. Now let's take a look at family services.
Good morning, everyone. My name is Ebony Rogers, and I am the new family advocate here at Sunrise. I will be presenting for family services. Our program goal is to provide quality family community engagement services that are, that promote for family well-being, strengthening parenting, parent-child relationships, and supports family engagement and school readiness. I'm going to start with the family partnership agreement. The data above reflects the program areas throughout the Q1 from October 23. Our families from home base and center base are now in an active family partnership agreement with us. This also shows that we met with our team to improve our systems and understanding of data entries. The amount of active family partnership agreements have increased.
Hello, good morning, everyone. My name is Vicky Hernandez, and I am the Family Services Coach. I will be sharing the goal setting for center base and home base. The goal of parent and family engagement is to build strong and effective partnerships with families that can help children and families thrive. The graph indicates that in the program areas, families in the goal setting process have increased. Family goals include 21.1% in education, 22.2% in parenting, and 29.2% specific to family needs. Therefore, for Q1, we have a total of 170 family goals set.
Our goal setting process starts after our family partnership agreement. Parent gauge is established with our families. A goal is identified, established, and discussed collaboratively between the families, between the families and their family service worker. Therefore, allowed us to better track and monitor the steps each family and team member are working towards their family goals. Our center-based goal setting graphs indicates that for Q1, there was 15 goals started, and for home-based, the goal setting graphs indicates 87 goals started as well.
For our family services workers have been consistently utilizing Ready Rosie as a parenting curriculum. The playlists that are sent to our families focus on specific learning and family outcome opportunities. Our center-based Ready Rosie graph indicates 889 playlists were sent and 177 videos were viewed. In addition, the home-based graph indicates that there were 85 playlists sent and 53 videos viewed. Therefore, we have a total of 143 registered users and 331 playlists viewed for the quarter one. Next, we will be sharing the Family Services Continuous Quality Improvement.
Prior area opportunity are pre-K transitions. Our objective to ensure transitions are being conducted in timely manner, utilizing a tracking system to monitor transitions, process, and end results. Expected outcome, team members will be able to track and monitor transitions for each child to better support families located in transition home. Excuse me. For quarter one update, in quarter one, 2 children transitioned out. 1 child went to a private school and 1 child went to SCF Pre-K. There will be 56 children waiting for placement.
For our next area of opportunity 2, it is to strengthen resources and referral processes within our organization to monitor and track progress and results for each resource and referral provided to families. Our objective is referrals provided to families will be documented on our Child Plus database, along with specific information on that referral agency. Expected outcome, managers and team members will be able to document, track, and monitor each resource and referral sent to families and gather accurate data pertaining to each resource and referral for follow-up. For quarter one update, Patricia, our family advocate, assisted families with apartment applications for those prior evictions and helped with economic resources for deposits. She also found resources for a family that was affected by a natural disaster at her apartment complex and was able to find a resource that the family was able to receive $2,000 in funds.
Go Patricia.
Yay.
So for our opportunity 3, to increase community partnership to facilitate access to additional mental health resources and services. Our objective, update resource finder and reach out to community to increase mental health and resources. Expected outcome, team members will have more knowledge of our community partnership to resources and will be able to share with families as needed. Quarter one update, family advocates and family coach explore services at CCSD Family Support Center, discovering assistance with immunizations and mental health, public services, and food banks for CCSD children and families. Thank you. Thank you to everyone for your time. Next, Disabilities and Mental Health will share for their data. Take it away, Angela.
Thank you, Vicki and Ebony, for our family services updates. Good morning, everyone. I am Angela Watlington, the Health and Disability Services Manager for Sunrise. Throughout the program year, our goal is to optimize the health, safety, and well-being of all children by offering a variety of ongoing supports to both team members and children and their families to ensure the full participation in program services and activities. This includes, but is not limited to, children who have chronic health conditions, special dietary needs, or those children who are eligible for services under IDEA, the Individuals with Disabilities Education Act. SCF is required to maintain 10% funded enrollment filled with children eligible for services under IDEA. During quarter one, we saw a steady increase in our enrollment percentage for children eligible for services under IDEA, beginning the quarter with 5.8% and ending November with 8.3%, approximately 32 children enrolled with an individualized family service plan, IFSP, or a therapy plan, TP. In comparison, SCF's actual enrollment for children with an IFSP or TP ended the quarter at 12.6%, 2.6% above our 10% goal. Additionally, we track children with open concerns. Those who are exhibiting challenging behaviors are suspected to have a developmental delay or pending a comprehensive evaluation for services due to an external referral. At the beginning of quarter one, there were 11 children with open concerns who were receiving additional support from Disabilities and Mental Health. And by the end of quarter one, there were 21 children with open concerns, an additional 5.5% of children enrolled receiving additional supportive services. One of the ways concerns are identified is by team members' usage of the Request for Internal Observation, RIO, a substantial part of how we track and monitor support being provided to our educators and children with suspected needs or concerns. During quarter one, we received a total of 11 RIOs, of which 3 were for social emotional development, 5 were for language concerns, 2 for both social emotional and language concerns, and 1 for gross motor concerns. Additionally, during Q1, a total of 16 referrals were initiated to external partners, of which 7 resulted from a RIO. There were 5 referrals submitted to Nevada Early Intervention Services, NEIS. 9 referrals were submitted to Clark County School District, CCSD Child Find, our local education agency in support of transition to Part B services. And 2 referrals were submitted to mental health child care consultation. SCF works with families to ensure children can participate in all program activities, regardless of condition or diagnosis. Special care plan meetings address the specific health, nutrition, or disability needs and any necessary accommodations of an individual and their family through planning and coordination alongside appropriate SCF team members. During Q1, a total of 32 special care plan meetings were complete, of which 11 were health care plans, 5 were nutrition care plans, and 16 were disability care plans. At the end of Q1, approximately 50% of children enrolled with an IFSP or TP had a disability care plan complete. Another component of disabilities and mental health is the development of SCF's trauma-informed care and practice, TICP framework, and the ability to offer TICP coaching to our team members. This process supports the strengthening of SCF and CCP team members' knowledge and understanding of social emotional development and mental health practices as it relates to the implementation of the pyramid model. Throughout Q1, our TICP and mental health coach provided TICP coaching to 9 SCF team members. Next, let's take a look at health, safety, and nutrition. Additional components of health services working towards optimizing the health, safety, and well-being of all children enrolled is ensuring children receive consistent and regular well checks and that they receive high quality and nutritious meals while attending our centers. SCF ongoingly works to support children and families in keeping their children up to date per the Nevada Healthy Kids early and periodic screening, diagnosis, and treatment schedule and the latest immunization recommendations issued by the Center for Disease and Control and Prevention. Our goal is to reach 90% of enrolled children who are up to date on their immunizations and to reach 85% up to date on EPSDT screeners. We began Q1 at 86% up to date on EPSDT and 92% up to date on immunizations, achieving our established goal. However, throughout the quarter, there was a steady decrease on up-to-date percentages for both requirements, and we ended Q1 at 59% up-to-date EPSDT screeners and 86% up-to-date on immunization status. SCF participates in the Child and Adult Care Food Program, CACFP, which sets parameters for reimbursement of eligible meals and snacks served to children as part of their regular daily care. CACFP programs must make reasonable meal and snack substitutions with consideration of individual, nutritional, and special diets. In Q1, we provided approximately 19,313 claimable meals over 67 operating days, roughly 288 claimed meals per day. For our Q1 health and disability services monitoring, the team conducted on-site visits to all 7 open EHS centers and partnership sites, inspecting and observing in each classroom and around the facility, utilizing our health and safety checklist. The checklist addresses 4 system components: facilities, equipment and materials, policies and procedures, and active supervision and observation, which included a total of 29 indicators used to determine center compliance. Overall, SCF centers met 89% compliance and 2 of the 7 centers meeting 100% compliance. Of the 4 system components addressed within the monitoring checklist, equipment and materials was the only area that had 100% compliance across centers. Alternatively, for the other 3 areas, active supervision was the second highest at 90% compliance, facilities at 89%, and policies and procedures was the lowest at 81%. Now we'll review health services CQI. For the 23-24 program year, health services identified the following 3 areas of opportunity to which the health team will align our continued quality improvement objectives with. Number 1, strengthen collaborative community partnerships and increase the number of resources and services available to families and team members related to health, nutrition, disabilities, and mental health. Number 2, strengthen internal auditing and monitoring systems related to the health and disabilities service area. Number 3, strengthen SCF and CCP team members' knowledge and understanding of mental health as it relates to the implementation of the pyramid model for supporting social emotional competence in infants and young children. At the end of Q1, the health services team had successfully distributed 1 newsletter and 1 fact sheet to families and team members and hosted the November 2023 Health and Disability Services Advisory Committee meeting. With some team member changes during the quarter, we face some challenges in meeting our objectives as it pertains to strengthening and increasing community partnerships and our ability to provide available resources and services to families. However, the health services team was able to conduct a deeper review of internal auditing and monitoring systems, identifying several policies and procedures that require revisions and the need to enhance trainings for team members. By strengthening internal systems, the health team expects to increase team member understanding and implementation of health policies and procedures and develop sustainable systems to supporting optimizing the health, safety, and well-being of all children enrolled. Finally, ongoing development of SCF's TICP framework continued, and collaboration between program area managers supported the planning process for the establishment of our first TICP cohort scheduled to begin in March 2024. We continue to focus on increasing internal communication and collaborative processes in support of strengthening and creating opportunities for emerging leaders by developing sustainable systems for training and professional development to increase team member capacity and ability to support children's social and emotional development with a trauma-informed lens. Now we'll pass it to Trina and Chloe for home visiting.
Thank you, Angela. I'm Trina Richardson, the home-based manager.
Hi, everyone. I'm Chloe Fidarco, the home visiting coordinator.
Today, Chloe and I will be talking about what's going on in home visiting. During the first quarter, home visits were switched to biweekly visits due to staffing. Leadership and team members have been working to fill these vacancies by attending recruitment events, ongoing interviews, and our very own SCF Hiring Expo. The data below reflects how home visiting data and home visiting attendance. Home visiting attendance fluctuated during this quarter, and it dipped into the 50% range in September and October, but began to rise in November. The largest absent reason has been family council. Parent educators continue to build connections and engage with families to increase home visit attendance. As I mentioned, the home visiting team is small but mighty, and at the end of the first quarter, there was an 80% vacancy in EHS and 62% for evidence-based home visiting. The data below shows the current team's credentials, and of the 5 parent educators, 4 were current in their inter-rater reliability and 1 in progress, while 3 were working on their CDA. 1 had not started, and one was not eligible due to having a degree. And lastly, 2 were PAT certified, while the others are waiting to attend the upcoming trainings. Chloe?
There were a total of 10 expected families enrolled during the first quarter, of which 7 were EHS and 3 were EBHV. Of the 10 families enrolled, none left the program prior to delivery, and 3 have enrolled their infants into EHS after delivery. Expected families receive 1-hour biweekly visits where they are given resources and information on topics such as fetal development, breastfeeding, and safe sleep, along with the risk of alcohol and drug use. The charts below reflect the services provided during visits. None of the enrolled families have been assisted with substance abuse or mental health referrals. Expected mothers have completed enrollment and postpartum Edinburgh screening. There were a total of 28 screenings during this quarter. The highest score can be seen as 15 and the lowest of 0. Mothers who scored high were referred to the mental health and disabilities team and provided resources to support their mental health. The mothers who scored the highest were diagnosed with depression prior to enrollment and received services from outside providers.
Thank you. And now we'll turn it over to Hippie. Thank you.
Jamie, are you there?
I am here. I apologize for the delay.
No,
My name is Jamie Stevens and I am the HIPPY manager. HIPPY stands for Home Instruction for Parents of Preschool Youngsters. The HIPPY program has experienced various adjustments over Q1 where our team members have had to adapt different roles and revisit policies and procedures. These steps helped us to establish expectations between team members, but it still came up with challenges that any change process brings. Thankfully, the use of data helps us to assess performance outcomes and dictates our next steps to improving our service for our families. We will go over some data and objectives for the HIPPY team's future. In relation to school readiness and achievement goals, we've completed 64 of our home visits for Q1, which totals 294 home visits, and we've conducted 93 supplemental visits alongside of them. 89% of home visits were able to confirm family daily reading, where we seek to have a full 7 days of reading each week. For our family health and economic self-sufficiency goals, we shared 137 resources with our families. Additionally, 97% of home visits were held where families were asked about behavioral concerns. For team member wellness and professional development, 4 out of 7 of our home visitors were listed as inter-rated reliable in 3 age groups, while 2 of the home visitors were current in 2 of the 3 areas of concern. Also, we strive to have 4.85% average reflective supervision hours for each home visitor per month. Additionally, you'll see that we have 36 of our children enrolled during Q1 received their initial developmental screening. These numbers show that there are numerous opportunities for operational efficiency that our team can improve on. Lastly, we'd like to share out on our in-kind hours. We have 30 parent volunteers, and we've had 513 hours in parent-child activities. And donated miles, you'll see we have 1,488. Areas of opportunity, Chloe and I will review. One area of opportunity that we have moving forward is to explore ways to encourage families to complete their HIPPY packets. This will help toward our goal of having families finish 30 packets by the end of the year 1. Chloe, what is our other area of opportunity?
Another area of opportunity is to have internal detailed data tracking around incomplete home visits, whether it's families or Sunrise team members having to cancel sessions for select circumstances. Detailed tracking will enable us to improve our higher attendance and complete rates around home visits. This will help us in revisiting specific systems that we currently have around assisting families with their attendance issues and finding innovative ways to engage with families, which can lead to our other goals that involve optimizing the home visit. Like how we use systems to effectively conduct our home visits, we should continue to build and develop the systems that we use to define what a resource is or what constitutes sufficient reading sessions to all our families. These will help in establishing expectations and making policy changes that meet families' needs and where they're at.
Moving forward, we will continue to focus on creating a multi-system approach to home visiting while we seek opportunities to standardize the data process to evaluate what future steps we should take to improve the overall service and experience for our participants. We also would like to explore ways to leave room for personal connections and unique experiences with families, because these connections will also serve as a base for a successful home visiting program.
These personnel connections and opportunities for qualitative data will still be structured and guided by procedures in some capacity, and our big goal for the upcoming quarters will be finding out how we can do that properly. Additionally, professional development opportunities are also another priority, especially easy, accessible ones that revolve around unique scenarios that team members may encounter. Thank you everyone for attending this HIPPY portion of Data Jam. Now, Nicole, can you tell us what's going on with NV Ready?
Hello, everyone. Thank you for taking the time to tune in to our SCF Pre-K and Nevada Ready programs. My name is Tommy Ramos, and I am the Interim Center Director for West Campus, here to share all the exciting updates we had for Q1. At West Campus, we currently have one classroom dedicated for our SCF Pre-K program. We currently have 8 children in that one classroom. The ages in this program range from ages 3 to 5 years old. During Q1, we had a total of 7 children enrolled. The top graph indicates the number of children that were enrolled and the number of children who were meeting the checkpoints. The graph also disaggregated into different domains such as social, emotional, physical, cognitive, literacy, and mathematics. During this checkpoint, our data shows that our children are meeting the widely held expectations under social, emotional, physical, language, and cognitive. However, our data also shows us that under the domains of literacy and mathematics, we have a total of 28.6% of our children who are meeting or exceeding the widely held expectations. The data also shows us that within these two areas, our teachers will be working more intentionally on supporting our children in these specific learning domains. In the second graph, the 2 graphs on the bottom is data per each indicator. Though we assess and observe the children in several learning domains, which are indicated in the top graph and bottom to show specific areas, the bottom left graph shows the widely held expectations for social emotional. Here you'll see that the bottom is 376, the top is 463, and our average score for Q1 is 427. The graph to the bottom right shows the widely held expectations for literacy. This graph reflects that the bottom number is 446 and the top is 509, which brings us to an average of 426. Our SCF Pre-K team members will continue to use this data in Q2 in efforts to better support our children in school readiness. To the right of this slide, you'll see data from our Nevada Ready program. This data is retrieved from our Nevada Ready classrooms at our West Campus location. We currently have 15 children in the classroom. The ages in the classroom are 4 years old. In this classroom, all children must be 4 years old by August 1st to be enrolled. Our Nevada Ready program in school and classroom works diligently in preparing our children for kindergarten. The graph to the right is generated from our Brigant screening summary report. As we progressively move into the program year, we will be sharing out 3 periods that we assess the children. For Q1, you'll see that the baseline data summary report that reflects the children below delays cutoff, within normal limits, and above gifted cutoff. The graph reflects that we have 10% of our Nevada Ready children who are above the gifted cutoff, 30% within normal limits, and 60% below delays cutoff. The children that fell below are the ones that will be supported by our health and disabilities team. Our Nevada Ready team members also have consistently been attending ongoing trainings, learning new and innovative ways to teach and showcase each indicator. Using this data and implementing the training supports them. They have retained. Our team members will be intentional in supporting our children in areas of opportunities to ensure that they're ready for kindergarten. Thank you for listening. Now I will pass it over so that we can hear more about in-kind.
Thank you, Tommy. Kathy Nickelbein again to share all things in-kind. In-kind activities are crucial in each child's early Head Start journey, going beyond classrooms and home visits to include daily parent-child interactions. Recognizing parents as primary caregivers, participating in in-kind activities not only enhances learning, but also strengthens the home-school connection. Moreover, families can accumulate in-kind hours, translating into federal funding for our program, as the federal government mandates programs to generate a minimum of 20% of their grant amount in-kind or non-federal share contributions. These contributions are essential for sustaining us and helping parents acknowledge their dedication to parenting. Despite the progress made in our in-kind data collection system last year, it did not meet our expectations. Families also found the system less user-friendly than anticipated, posing challenges for those with limited access to technology and managing usernames and passwords. We are now focused on enhancing our system and recently reintroduced a new old system in October to collect and track volunteer hours, reverting to a paper-based system for families with SCF team members responsible for entering data into our child data tracking system, Child Plus. This enables us to record and categorize data as needed. Since the launch of the new system until the end of the first quarter, we had 35 parent volunteers contributing a total of 85 hours and 52 minutes, along with 12 participants from the Job Discovery Program, or JDPs, or other volunteers contributing a total of 1,217 hours. Moving into the second quarter, our enrollment numbers will look a bit different, especially with the additional classrooms at City Impact, the opening of our Northwest campus, and the inclusion of family child care providers. We are eager to discover what the upcoming quarter has in store as we further improve and gather data while parents continue to keep track of their children's learning and time at home. As you saw, throughout the program year, we gather, analyze, and break down our own data for various purposes. We also conduct a thorough community needs assessment every 5 years with yearly updates. This assessment has helped us identify crucial elements, long and short-term objectives, and areas of opportunity aligned with the Head Start program performance standards. It includes details on our service area, demographics, child development programs, available resources, and community strengths. The assessment is refreshed annually to provide a comprehensive overview of Clark County's resources and initiatives. This year's comprehensive community needs assessment highlighted 4 key areas of opportunity in the community. 1 being childcare deserts. Approximately 1/3 of Clark County residents reside in areas with limited childcare services, especially in rural areas like Laughlin and Mesquite, Nevada. This scarcity is particularly challenging as many residents in childcare deserts also live in high poverty areas, hindering access to quality childcare services. Second was foster children. The data indicates that a small percentage of foster children are currently being served by Sunrise Children's Foundation, emphasizing the necessity to expand services to better assist these vulnerable children and families. 3 are families experiencing homelessness. Homelessness remains a significant issue in Clark County, underscoring the demand for more comprehensive support services to address this ongoing challenge. And then last but not least is the mental health and well-being. The prevalence of mental health issues is on the rise, with Nevada ranking 49th in the nation for support and services. Survey results from our needs survey highlight a critical need for enhanced mental health systems, particularly in the zip codes associated with North Las Vegas, Henderson, Boulder City, Laughlin, and Mesquite. Strengthening these systems is vital for promoting positive mental health and overall well-being. Following the completion of our community needs assessment, our team was able to come up with a set of comprehensive community impact goals and objectives for the upcoming 5 years. The first goal is to increase program options and access to high-quality childcare services throughout Clark County. The primary objective is to enhance program diversity and accessibility to quality childcare services across Clark County. Key objectives under this goal encompass the expansion of services into Mesquite and Laughlin, Nevada, regions identified as childcare deserts, and the inclusion of family childcare providers to offer families an additional care alternative. In Mesquite, negotiations have been underway for a facility to accommodate 3 early Head Start classrooms serving 24 children serving 24 children with plans to initiate services as soon as possible. The introduction of home visiting programs in Mesquite aims to serve 11 families through the Early Head Start Home Visiting Program and 15 families through the HIPPY program. Similarly, in Laughlin, negotiations with the school district are ongoing to secure space for 4 Early Head Start classrooms serving 32 children. Meanwhile, the recruitment of team members and families in both Laughlin and Mesquite are underway, with home visits being provided to families until those classrooms can open. For family child care providers, a promising collaboration with Care Nevada and the Children's Cabinet has been established to partner with 6 family child care providers. Notably, Care Nevada has joined forces with an additional partner to acquire homes in Las Vegas suitable for family child care providers. These providers are linked with QRI coaches, everybody, to aid in establishing quality home care environments. We aim to support this collaboration by enhancing provider compensation and benefits, offering support for providers and staff, including training, professional development, networking, peer learning, and coaching, support and guidance on high-quality environments, which could include purchasing of furniture, equipment, supplies, materials, and facility improvements if necessary. Furthermore, access to a high-quality curriculum for support and coaching, access to resources to improve family and child well-being are also provided to families. Our next goal is to increase the workforce and leadership opportunities within the community. This includes increasing our partnerships throughout Clark County with various higher education entities, high school pathways program, and state and privately funded workforce training programs to bridge workforce and educational gaps within the state to increase the ECE workforce and growth opportunities. We continue to seek out partnerships with these local businesses and organizations to create internships and job shadowing opportunities for community members who may be interested in the early childhood education field. By working closely with educational institutions and workforce training programs, we aim to provide the necessary support and resources for people to pursue fulfilling careers in the early childhood education field. Our last community impact goal is to provide increased services and opportunity to historically marginalized populations, which include, but not limited to, Black, Latino, Indigenous and Native American, Asian Americans, and Pacific Islanders and other people of color, children experiencing homelessness, children in foster or kinship care, children with disabilities, and children who are dual language learners. One of our key objectives is to collaborate with community partners to establish transitional childcare services for families experiencing homelessness. Additionally, we aim to enhance our involvement and engagement in various community and state associations and alliances. By doing so, we aspire to enhance the accessibility of services for families from minority backgrounds, forge new partnerships within the community, foster an environment free from bias that nurtures children, families, and program team members, and expand resources, opportunities, systems, policies, and support for all providers, staff, and families to help them achieve their fullest potential in life. And that concludes part 1 of Data Jam. We extend our gratitude to all our valued and esteemed guests and team members for joining us. And our hope is that everyone was able to gain more knowledge and understanding of all our program area goals and objectives. All our guests are excused, and we wish you a beautiful, happy Tuesday. For all our other SCF and CCP team members, please hang tight. We're going to take a 10-minute break so that our managers and other team can catch their breath, get another cup of coffee, and then we're going to come back and we're going to do some interactive data activities. See you in 10. Maybe.
Thank you, everyone. Kathy, thank you so much. You guys go ahead and stop the recording.